Okay, good to go.
Okay. Hi, my name is Robin Elliott. I am one of the co-founders of Georgia Overdose Prevention. This is my son, Zach. Zach was a beautiful, bright, talented, sweet kid. Unfortunately, he also was an opiate user, and he lost the battle on May 1st, 2011, passed away from an overdose of opiates. After that time, I got involved trying to get a law passed in the state of Georgia to enable people to call 911 and not get arrested if they had drugs on them, if they called in good faith because someone was overdosing, and also to allow regular individuals to carry Narcan or naloxone. Naloxone is the generic name, Narcan is the brand name of the drug that is actually an opiate antagonist. It reverses opiate overdoses. So prior to the law getting passed in Georgia and in most states in the United States, Narcan was only on ambulances or in operating rooms, because it was on ambulances if you were lucky. It was in emergency rooms, definitely, and in operating rooms, because doctors always have this if they're operating, because it will reverse people that are getting opiates during surgery too. So I mean, it's been around since the 60s. It's a very common drug, but it just has never been used the way that it's being used today, which is by just regular people to try to save lives. So anyway, we got the law passed in 2014 in the state of Georgia, and as a result of that, people can now call 911 and not get arrested if they are with somebody that's overdosing. And also regular people, just like us, can carry Narcan and reverse overdoses. So the way that it works, it's a really, really interesting drug. The way that Narcan works is everyone, every human being has opiate receptors in our bodies. And we have them in our brains, in our spinal cords, and in our abdomen. And that's because we produce something similar to opiates, just naturally, endorphins, which they might be released in your body if you run a marathon, eat chocolate, all those pleasurable feelings that come from doing fun things. You release endorphins in your body, which then, when the endorphins are released, that releases dopamine, and you get those pleasurable feelings. Well, those receptors that we have in our bodies are also what makes people have pleasurable feelings when they take opiates. Opiates are they're opiates and opioids. So some are natural and some are synthetic. So it's heroin, Dilaudid, fentanyl, Loratab, oxys, roxys, all the fentanyl analogs, morphine, codeine. Those are opiates. So we have these receptors in our bodies, and when you take an opiate, the opiate comes into your body and it sits on that receptor. And when it sits there, it generates those really pleasurable feelings. It gives you feelings of warmth and generates pleasurable feelings. But at the same time, what happens is that opiate is also a respiratory depressant. So when that opiate is sitting there, it's depressing the person's respiration. It's depressing the person's respiration so that they breathe fewer and fewer times per minute and more shallow, until finally they're not getting any more oxygen to their body, and unfortunately they pass away. So what Narcan does, Narcan was discovered or developed by a gentleman in New Jersey who worked for a pharmaceutical company, and what he discovered was that Narcan, those receptors in your body like Narcan better than they like opiates. So if you've got opiates sitting on those receptors and you can get Narcan or naloxone, the other name for it, into somebody's body, that Narcan's going to come along and it's going to go wham, and it's just going to knock those opiates right off the receptors, and the Narcan's going to take its place. It's going to sit there, but it will not allow those opiates. They're still floating around in your body, but it's not going to allow them to get back on those receptors for 30 to 90 minutes. So for 30 to 90 minutes, that person is going to not have the opiate receptor sitting there. So what happens at that time is two things. Number one, because Narcan is not a respiratory depressant, it sits there, but it doesn't depress the respiration. As soon as that Narcan's sitting there, it's going to start knocking the opiates off all those receptors in your body, and suddenly that person is going to take a huge gasping breath because they're starved for oxygen. They're literally going to go, and they're going to get oxygen into their body. The second thing that it's going to do at the exact same time, though, is as it's knocking those opiates off those receptors, it's going to throw that person into precipitated withdrawal. Because normally what happens when somebody stops using opiates is the opiates gradually start floating off those receptors. This is going to knock them all off at the same time. So it's going to throw somebody into precipitated withdrawal. They are not going to be happy. The last thing they're going to remember is they were feeling great. Now they're not happy, but they're breathing. So hopefully that's a good trade-off. So what we tell people is, if you come across somebody and you think they may be overdosing, you may notice a million things. You may notice pinpoint pupils. They may be sweating. They may have blue lips. They may have blue nail beds. They may not be barely breathing. We don't want you to waste any time looking for any of those things, because time is tissue. This person needs oxygen as fast as you can possibly get it to them. So this is all I'm going to ask you to do. I'm going to ask you to walk up, and you're going to try to check them for unresponsiveness. First thing you're going to do is look at them, and if you know their name, you can say, Bobby, Bobby, can you hear me? Shake them. So now they see if they respond to touch and to sound. If they don't respond to either of those two things, then the next thing you're going to do is see if they respond to pain. You're going to take your knuckles, these bumpy knuckles, not these little flat, easy ones, these big bumpy knuckles, and you're going to press them as hard as you can. Rub up and down the sternum, right here, as hard as you can, like you want to try to bruise them. Because you're trying to see if a normal person under normal circumstances is going to go, hey, what are you doing? Stop. If you don't elicit a pain response from that person, then the very next thing you're going to do is get them down on the ground, flat on their back, and administer Narcan. So very quickly, shake them, yell in their face, rub your knuckles up and down, do a sternal rub up and down. If they don't respond, you're going to put them flat on their back, on the floor, on a hard surface. I mean, it doesn't have to be the floor, but the floor is usually the easiest. And the reason for that is because later you don't want to ever leave them on a soft surface like a bed, in the backseat of a car, anything like that, because if the 911 tries to get you to do CPR or chest compressions, they won't work on a soft surface. You need a hard surface behind the person's back, so that when you push down, you're trapping the heart, and the heart is going to push out blood, which then spreads oxygen through the body. But if you do it on a soft surface, you're just going to push them all the way down. So flat on their back on a hard surface, and then you're going to grab your Narcan. This is Narcan nasal spray. This is the one that I'm going to be sending up to you. We think it's the best version. There are a number of other versions, but this is I think the easiest to administer. Inside the front flap, there's a little handy dandy cheat sheet. So if you forget anything I say, it's right there. It's almost impossible to do this wrong. So you're going to open up your kit, and inside each kit there are 2 doses. So when you open up your kit, there's 2 doses. You're going to pull one dose out, and it's in this package. Just a little blister pack like this. Pull it back. It is ready to go. There's no cap on it. Do not ever prime it the way you would a regular nasal spray. There's one teeny tiny dose in here, this much liquid. If you press this too soon to prime it, you've lost it. It's gone. You don't ever want to prime it. So you've got your victim on the floor, on their back. The first thing you want to do, you want to tilt their head back. 3 reasons for that. Number 1, open their airway. Number 2, you want to take 1 second and look in their mouth. And there's a really good reason for that. We've known of people that have taken the cap off the needle, and it's in their mouth, and when they take that gasping breath, they breathe it into their windpipe and it gets stuck. So you want to take a minute, open their mouth, and just look around. Take your handy dandy flashlight app on your phone, look and see, is there anything in there besides teeth and tongue? If there is, cover your hand, take it out. And the third reason, and most important reason you want their head tilted back, is, as I said, there's a teeny tiny dose of liquid in there. If they're like this and you spray this up their nose, it's going to run right back out. It's not going to do its job. These people are probably not breathing. They're definitely not going to be listening to you if you say, take a big sniff in. They're not listening. The way this works is you hold their head back. This liquid is going to be absorbed through the little capillaries in their nose, and it's going to go into their bloodstream. So you want to make sure it stays in there. So you got them on their back on the floor, tilt their head back, open their airway, look in their mouth, and keep their head tilted back. And then you're going to take your naloxone, you're going to stick it up one side of the nose as far up as it'll go. Don't just put it right here, up as far as it'll go till the tops of your fingers touch the bottom of their nose, and just push the button. And then you're going to call 911. Narcan first, call 911 second. Time is tissue. You don't want to waste time talking to them, waste 2 minutes talking to them while this person isn't breathing. So now you call 911, put your phone on speaker, that frees up both your hands, and then just do whatever the people tell you to do on the phone. They may tell you to do chest compressions, they may tell you to do rescue breathing. They're probably gonna say, is the chest moving up and down? If so, tell us how often. So you'll just say, and they'll tell you a word to say like, now. They may ask you to feel for the pulse. I encourage you to practice feeling for a pulse on someone else. It's easy to find your own, but it's hard for people to find the pulse on somebody else. So the last thing you want to do is tell them there's no pulse, but there is a pulse, but you couldn't find it. So practice that. Just practice finding a pulse on another human being. So they may say, every time you feel the pulse, say a word. It might be beat, 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 whatever. After 2 minutes have gone by, if that person hasn't sat up, taken a deep breath, started cussing you out, done something, there's a variety of things that could happen. They could at least be changing color even. A light-skinned person like myself will be bluish looking. A dark-skinned person will be gray. So if you start to see their colors changing and they start rousing a little bit, then that means that they are responding. But if you do not see any response, then you're going to reach into your kit. You're going to grab your second dose of Narcan. You're going to pull the blister pack back, take your dose out, put it up the other side of the nose if you can remember. If you don't, it's okay. Don't worry, this is going to be a very hectic situation, but we prefer you to try to get it up the other side of the nose because that'll be drier and more absorbent. And just press the button again. Tell the 911 operator. When you first called her, you should have said to her, this is so-and-so, I'm in the presence of someone that I believe is experiencing a opiate overdose. I've administered 1 dose of nasal Narcan. And then after 2 minutes, if they haven't responded, you're gonna get your second dose, and then you're gonna tell 911, I've just administered a second dose of Narcan. You can continue to administer Narcan to someone for however many doses you have. You cannot give them too much. We've known people to get 21 doses. Most times 1 dose works, and almost always 2 doses work. But we do know people here in Atlanta that it's taken 6 to 8 doses to revive someone, and those are people that have fentanyl mixed in with whatever drug they were taking. This only works on opiates. It does not reverse overdoses on cocaine or alcohol or benzodiazepines like Xanax or something else. However, almost all drugs, cocaine, meth, counterfeit pills like benzos, ecstasy, almost all of them are laced with fentanyl now. So if you come upon somebody and they look like they're overdosing and somebody with them says, oh, they only do meth, they only do cocaine, that won't work on them. Give it to them anyway because it can't hurt them, but there may be an opiate in the cocaine and it will reverse that part of the overdose, which will probably be enough, frequently be enough to pull them through. A frequently asked question is, what if you administer this to someone that is not overdosing? If someone's having a diabetic coma, or somebody is having a heart attack, or something else, it does nothing. It does nothing except Nalana. It does nothing except reverse it all. The only thing this drug does is takes opiates off those receptors. So if they don't have opiates on those receptors, it's going to do nothing. So you don't have to worry about administering it to somebody. So now your victim's on the floor and suddenly they are starting to come around. They're not sitting up, but they're starting to revive, and they're saying, what happened? The very next thing you want to do is you want to roll them over in a recovery position on the floor, arm under their head, leg over one side so that they stay on their side. And the main reason for that is frequently in this situation, someone will vomit. And the very last thing you want to do is just save this person's life and have them vomit and aspirate their vomit. So you just want them on their side, so if they vomit, it won't go down into their lungs. They won't suck it into their lungs. They can still have an open airway. And then you're just going to wait, and hopefully by then 911 is running through the door, and you're going to just hand them whatever you've got, tell them what you did, and they're going to take it from there. A couple of really interesting things about Narcan. Number one, there is an expiration date on all Narcan, just like there is on all drugs. There have been a number of studies done. The two most recent ones, one was done by the Department of Defense, and it showed that Narcan lasts between 60 and 95 months past the printed expiration date, and they stopped testing at 95 months. The most recent study was done in the past 2 years, and it was they collected naloxone from ambulances all over the United States. It was expired, and they tested it to determine the level of efficacy, and they had Narcan dating back 28 years, and all sorts of time frames in between now and 28 years, and they had 0 failures. So our position is, if you've got it, use it. You will more than likely be able to save someone's life. Second thing is, it does have a temperature. It says keep it between 59 and 77 degrees. They've also done tests on that. They took it down to -2, up to 102, down to -2, back up, down, back and forth. They found that in the worst case, it lost 10%. So it's still, which means it retained 90% of its efficiency. So what we tell people is keep it where you need it. It's not going to do any good if it's sitting at home in your nice 72-degree home if you're out and you're encountering somebody and you don't have it with you. I keep one in my purse and I keep one in my car all the time. And the last thing is, as I said, it lasts for 30 to 90 minutes. So, and the reason that's really important is because sometimes people that have been reversed refuse transport to the hospital. So what I would suggest is if you're with a loved one and they refuse, or anybody, and they refuse transport to the hospital, that you stay with them for 6 to 8 hours, because Narcan, 30 minutes is sitting there, and the Narcan then can start to float off the receptors. And those people can still have enough opiates in their system that their opiates can float right back on there, stick back on, and people can go back into their overdose without taking any more drugs. And we've seen it happen multiple times in the emergency rooms. So it only lasts for 30 to 90 minutes. So please encourage people to go to the hospital so that they can be monitored properly by medical professionals. And that's about it for that. We, as an organization, have distributed over 38,000 kits in the state of Georgia. We ask people if on our kits, this is what the kits look like. On the kits, there's an email address down here. We ask people if you use the kit to email us and let us know that you had a successful reversal. Since we started distributing kits in 2014, we have gotten 2,400 responses that we've had successful reversals. So those are 2,400 human beings that lived for another day. You know, our mission is truthfully to keep people alive long enough to get into long-term recovery, because unfortunately, as many of us know, dead people don't recover. And not all people will get into recovery either that use Narcan, and that's okay with us too, because really we just want to keep people alive. Hopefully to recover, but not always. So I'm going to just check my my notes real quick just to make sure I didn't miss anything really vitally important. 111, no response, stay with the victim. Yep, looks like that's it. So, you can always contact me through Liz, who's my dear friend, and if she's unavailable, you can also write to us at any time at info@georgiaoverdoseprevention.org. We'd be happy to answer any questions if you have any, and I hope that this training helps. And like I said, our mission is just to keep people alive, and our tagline is where there's life, there's hope. Thank you.
Thank you.